We are committed to bringing you and your family the information you need to navigate these uncertain times so we can all bounce back together. It's the focus of our Rebound Idaho series. Our Madeline White leads our coverage tonight with a look at how healthcare is evolving in the time of COVID-19.
Telehealth isn't perfect. Internet accessibility is a problem for people, especially in some rural parts of Idaho, but it's better than nothing, especially in this time of uncertainty.
And even people who aren't chronically having problems with mental health are now, they're in fear of taking pay cuts, losing their jobs, having to file for unemployment, things that many people have never even thought of.
An American Psychiatric Association poll from March shows that nearly half of Americans were anxious about possibly contracting coronavirus, and 62% were anxious about a loved one falling ill.
What we've seen recently is a significant increase in the prescription of anti-anxiety medications.
But telehealth has played a major role during the pandemic in keeping patient oversight operating while flattening the curve. It existed pre-coronavirus, but it was somewhat limited to mostly rural areas. That's not the case anymore.
Patients no longer want to go to the emergency room for other kinds of problems, so they don't want to necessarily go to their doctor's office because they're afraid they'll be in a waiting room with a bunch of sick people.
The Trump administration recently changed their policy in response to COVID-19 so that Medicare patients may temporarily visit doctors and clinicians by video conference at no additional cost, effective for the more than 320,000 Idaho residents that are enrolled in Medicare.
This is a real benefit for seniors and all the beneficiaries.
Dr. Sullivan hopes this coverage remains.
Because doctors and patients are kind of being forced to do this now, maybe it's making them see the value.
Yeah, you're right. You're right. It's like an accidental evolution. It's sort of like a natural experiment that we weren't looking for, we weren't entirely prepared for, but okay, we're going to learn from this and we'll come out better on the other end.
For more tips on how to manage the pressure during this time, visit idahonews6.com/rebound and select the Managing the Pressure tab. Madeline White, Idaho News 6.